laparoscopy, and this patient has an endometriosis cyst here and another one here, and then like a little superficial endometriosis lesion on the ovary. Ovarian cysts that are endometriomas often cause infertility, okay, because they're taking over the function of the ovary, and these typically require surgical excision, not drainage, okay? So this is sometimes an inexperienced surgeon may go in, and when they may go in to treat this ovarian cyst, and when they see that it's an endometriosis cyst, or maybe there's a lot of scar tissue, which is again shown in this little diagram, they may feel that they're not necessarily able to excise or remove this cyst, so they're just going to drain it. The reason drainage is not the right thing to do is because the cyst will just fill back up with the same fluid. So draining it is not treating it at all. The cyst wall, which is the outer portion of the cyst, has to be removed completely. And again, the time is of the essence, because the earlier you do that, the more likely you're going to have good amount of ovary still there remaining. So here I like this picture because it's showing how there's very little ovary here at the bottom, while the rest of it has been replaced by an endometrioma. And as this endometrioma continues to grow, that little sliver of the ovary gets smaller and smaller and smaller. So if you're going to treat endometriomas conservatively, there may come a time where it's going to get so large and there's going to be so little ovarian tissue remaining that you're basically losing the entire ovary. So that's the issue with delaying care, is that, unless you don't care what happens to the ovary,